Hi, my name is Shannon Besink. For my opioid project, I decided to discuss the use of the McKenzie method as a way to treat chronic low back pain as an alternative to long-term opioid use to treat chronic low back pain. So chronic pain is defined as pain lasting 3 or more months. The way this pain can be characterized can be dependent on several factors. So, for example, how much the chronic pain is affecting function. So maybe that's workplace performance or just general quality of life and ADLs. Can also be characterized by how widespread the pain is. So whether the pain is just localized to, for example, say the elbow versus maybe the entire upper extremity. There's several factors that can increase the prevalence of chronic pain. So social factors that having to do with tenuous housing, economic insecurity, low education level can all correlate with chronic pain. Sleep quality, so inadequate or poor sleep quality. And then emotional factors being depression, anxiety, anger, hostility, etc. You can kind of see how all these factors will interplay with each other, where someone maybe with economic insecurity or working a lot of hours may not get very good sleep, may have depression as a result of all the stress, and how that can all kind of interloop to increase chronic pain. One relevant statistic is that kind of due to the aging population, due to just the increased sedentary lifestyle in the United States, chronic pain has increased to 43% of American adults. So at some point in their life, about 30 to 40% of adults in the United States have been found to encounter some kind of chronic pain. So unfortunately, with this increase in chronic pain in the United States, we can currently have an increase in opioid use and opioid abuse. This increase started in the 1990s. This is kind of due to a variety of factors. There were beginning to be reduced regulations on opioid use to where it was more available, especially in the long term for more long-term treatment of pain and different pathologies. Some kind of startling statistics is about 20 to 30% of chronic pain patients misuse opioids, while about 8 to 12% become addicted. So if you do the math on that, that's about 40% of this population becoming addicted or misusing or abusing their opioid prescription, which is not that far from half. So that's a very significant chunk, especially given the fact that chronic pain patients are increasing in the United States. This has gotten to a point where in 2016, the CDC officially released a statement saying that there was no evidence for long-term benefit of long-term opioid use, meaning that, in the short term, maybe it could be a positive thing to get out of that acute stage, but in the long term, there has been no research to indicate that opioids are beneficial. So, what most people think of when they think of chronic pain, one of the main examples is chronic low back pain, which is extremely prevalent. And then putting that together, we also see that 66% of those with chronic low back pain are prescribed opioids. So you can kind of see how that would be a little startling given the evidence that chronic pain is on the rise in the United States, opioid is used more extensively in the United States, and a good portion of people with chronic low back pain are prescribed opioids. So you can see how there'd be a very high chance for abuse in that situation. So how do we combat that outside of opioid use? One other statement from the CDC says that there's significant evidence that there are higher benefits and lower risk associated with non-pharmacological treatments for chronic pain. So, what is a non-pharmacological treatment? Well, one of them is physical therapy. So treating low back pain can be pretty complicated, and it sort of gets more complicated when you're talking about chronic low back pain. So one method I found that has been shown to be effective in treating chronic low back pain is the McKenzie method. So one important thing to conceptualize when you're thinking about the McKenzie method is the concept of centralization versus peripheralization. So centralization refers to motions that are going to decrease your pain in a distal to proximal manner with certain movements. So in the case of low back pain, say you have pain starting in your lower back that's radiating to the lower extremity. However, when you flex forward or flex backward, flex to the side, or extend backward, you have a decrease in those symptoms from a distal to proximal manner. So maybe the pain now is only occurring in your lower back with those movements, or maybe it totally disappears. This is compared with peripheralization, which is just the opposite. So say you're just having general low back pain, but whenever you lean forward or extend your spine, that pain is going to increase from a proximal to distal manner. So maybe it radiates down your leg, or it's already radiating, but just goes even further. So that's the primary thing that the McKinsey method is going to focus on. So whenever you do the McKinsey method, you have the patient perform certain movements, and based on the symptoms they present with, you'll have them in different classifications of low back pain. So the most common diagnosis that you'll see with the McKinsey method is derangement. It's about 80% of the diagnoses. So this is going to involve a disc dislocation that is going to occur with centralization, so that loss of pain in a distal to proximal manner, or just total disappearance of the pain with a repeated unidirectional movement. So say repeated spinal extension, repeated spinal flexion, etc. So based on the classification is how you're going to treat the patient. So treatment for derangement involves those same movements that decrease your pain in a centralized manner. You can also have a dysfunction classification that's going to be more involved with traumatic, inflammatory, or degenerative processes. This is going to see pain at the end of a range of motion with just one movement due to one of those processes. And the treatment's going to be a little different. That's going to be mobilization with the direction of dysfunction. You might also have a postural diagnosis in which someone increases their pain at a sustained position. So think of like a secretary sitting slouched forward all day. And the treatment of this is simply to just do postural correction. But of all those cases, most often you're going to see derangement, which is based off that centralization principle. So the McKinsey method has demonstrated pretty significant clinical use. There is moderate to high quality evidence that the McKinsey method may be an effective way to treat chronic low back pain in decreasing pain and disability levels. Additionally, it's been found to have some success within the cervical spine. So if you're seeing a patient with chronic cervical issues, this may be another option for treatment. It should be noted that the McKinsey method has not been found to be an effective way in treating acute low back pain. However, if we look at what we've learned with the increase in chronic pain, that's pain lasting longer than 3 months in the United States, and increase in opioid use, we've got a pretty significant portion of the population of those with chronic low back pain being prescribed opioids. The McKinsey method may be a good way to decrease pain with your patients to where they feel better getting off opioids or just avoiding opioids altogether. And these are my references. Thank you so much for listening to my presentation today.